Chemotherapy wasn't a part of my treatment plan, but I know for many of you it is. That's why I sat down with my good friend Farla, a fellow breast cancer thriver, to talk about what it's really like. From side effects and must-have items to tips to getting through it, this conversation is full of real talk and helpful advice. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. What was your reaction when your oncologist said that you'd have to do chemo?
I said no. And she turned to me and looked at me again and said, "Do you want to die?" And I said, "No, I don't want to die." And she said, "So?" And I said, "I guess we're starting chemo."
And it was so immediate. You were like, I just don't want to do it.
I got diagnosed and in October, and I'm sitting in the oncologist's office and she's saying, "Okay, now you're doing chemo." And I'm thinking, okay, great. I'm just going to start it in January, in the new year. I'm going to go away for the holidays, enjoy my time, allow my mind to get into it. And she's like, "Okay, well, we're going to put your port in 2 days, and that day you're going to start chemo." So it was absolutely immediate. I had no time to really process it in my brain of what was actually going on.
And then was the no immediately for what reason?
I didn't
like multiple reasons?
No,
or?
one reason. I didn't want to lose my hair. I didn't care about any of the other side effects. They hadn't really applied to me, I guess, and I really didn't think deeply of them.
Sure.
And I just said, I don't want to lose my hair.
Right.
And it came down to that one fact.
Right.
And she said to me, "You have no choice."
Right. I remember you were telling me the story of that first appointment, and then you went in and you were, dressed up to the nines.
Oh, yes. I thought
and your hair, what she said about it.
Yeah, so I went in and I completely dressed up, which was hilarious.
Yeah, I was probably wearing like my gym clothes.
Okay, so I was wearing a business suit, carrying my bag, thinking I'm going in for actual like a consulting appointment.
Right.
And with a big binder, so I'd already done all my research already. Yeah. And in my head, I kind of knew that I had to go down the chemo path because I had gone on the portal and I had read everything. And you can only imagine.
Yeah.
And so I dress up, I come in, I hand out my agenda. And I think I'm doing a business meeting right now, and there's no negotiating. And she looked at me. I can tell when she walked in, I had very long, curly, blonde hair.
Yeah.
And she just looked at me and kind of felt bad for me.
Yeah, because she knew.
She knew right away. Yeah. And when I said no, she knew why I was saying no.
I remember you were saying you defined yourself, in
by
part.
My hair.
Right? Yeah.
Exactly, right? Because people would recognize me, see me across the street, because I had such long, curly, blonde hair.
Right.
And so I loved it. Right? I stood out. My biggest fear is I didn't want anybody on the street seeing me and saying, "Oh my God, she has cancer."
Right.
I was so scared of that.
Right. So chemo was on the table for me at some point, and then I did that oncotype testing, which if you're ER/PR positive, HER2 negative, you do.
That's right.
And we'll talk about yours in a sec. But my score that came back was low, and that meant that if I did chemo, it wouldn't have helped at all.
Yes.
Right? But that meant that I kept my hair, but then I never really looked like I had cancer. Right?
Yeah.
So I looked like well, and at some points that's really nice, and then at other points when how you look on the external doesn't always match how you're doing internally, right? Going through cancer treatment, especially more in the later stages, but it's so vulnerable, and you're not anonymous when you lose your hair like that.
Not even close. And that was my biggest fear. And it's interesting that you say that, because today, even people look at me, they go, "Oh my God, your hair's back, you look amazing." And I'm like, okay, but I feel terrible, right?
Yeah.
But it's that perception versus reality.
Sure.
I wasn't even ready to admit that I had cancer yet.
Yes.
And that's what it came down to. I wanted everything to be normal.
Right.
That was my big thing. Everything has to stay the same.
Yeah.
And I thought I was going to take on this chemo like on the side of my desk.
Yeah.
And between the chemo treatments, I was just going to continue doing everything else I did.
Sure.
Right? And I could just add it into the calendar of things that I typically do on a daily basis.
Right.
It obviously that was not the case.
Yeah.
But that's how I was treating it. I was just treating it as just another to-do list on
Right.
my action item that I
Right.
was going to, kind of plug it into my calendar and say,
Right.
okay, today I have chemo,
Right.
and I'll go to chemo, and then after that I'll get on a plane and I'll go to a client, and nobody's going to know anything.
Right, right, right.
So it was all about how do I maintain control?
Yes.
And that's what it came down to. And when your hair falls out, that's where you lose control.
It's gone. For context, let's share a bit about your diagnosis.
I had stage 2, grade 2 invasive ductal carcinoma.
Same, yeah.
And I was PR positive, 60%. I was HER2 positive, and then I was 100% estrogen positive. So it was considered aggressive. That is why there was no chemo on or off the table. Chemo was on the table.
100%. Right.
And the HER2 positive meant that I had to do Herceptin.
And then give sort of a timeline of how long ago this was, how old you were.
So I was 51 when I was diagnosed. I was diagnosed in October of 23.
Okay.
And I completed my last chemo in March of 24. And then I completed my Herceptin November of 24. And I'm still now doing Zometa, which is just to protect my bones for the next 2 years.
Okay. You had chemo first.
Yes.
And then you had surgery, which was?
A double mastectomy. So I did that in April of 24. So
Yeah.
a month after I finished my chemo.
Yeah. And you had tissue expanders in?
I had for
at that
1
time.
year.
Yeah.
I had my exchange surgery this year in 25, April of 25.
Yeah.
And then I also opted to take out my ovaries and my fallopian tubes. And I had that done in October of 24.
Okay.
So I've been very busy.
Yes. Okay, tell me about the type of chemo that you had.
I did 6 rounds of chemo. I had carboplatin, doxytaxel,
Yeah.
and then Herceptin.
Okay.
And I actually made a change to my chemo. Go back to the fact that I didn't want to lose my hair.
Sure.
I had made the decision, I had done the research that I wanted to do cold capping.
Yeah.
And I was very excited about it. And so last minute, she actually changed one of the chemos in hopes that the cold capping would work.
Okay.
So that was kind of the negotiation. So I talked about how I negotiated. I didn't want to do chemo, but I didn't win on that front.
Right.
But I won on the front that she changed one of the chemos
Okay.
in hopes that the cold capping
Right.
would actually
Right.
work.
And then how, in terms of the whole procedure and how it all worked, because it's a whole thing. Like chemo is enough on its own, and then you're just really adding a whole nother layer to that.
It is very time consuming. So chemo is long on a good day.
Right.
You have to go in there an hour or 2 before so they can prep you.
Okay.
And they put on this crazy shampoo on your hair to get it moist, and then they put this,
Like your whole
your
hair,
whole
or not
hair.
just like?
Not even the top. It
Okay.
was all the way down. Remember how long my hair was?
Yeah.
So they put it all on, and you're absolutely shivering and freezing. And then they're putting this ice cap on your head, and then they put another cap over your head. And they plug you into this machine. It looks like a vacuum or even like a mini fridge.
Right.
And it's freezing on your head. So you have this very cold head, and sometimes you get headaches from it.
Yeah, I was gonna ask.
Yeah, so they tell you to take Tylenol.
Okay.
Sometimes you just don't feel great,
Right.
Because it's also very tight, and like tight around your chin.
Because that was where the strap is?
Yes, and the more that they can constrict, so the tighter they can be, they say the better it's going to work.
Right.
Right.
Because there would be more ice like applied, really.
Exactly.
Yeah.
And so then you have this long chain, and you're like attached to this machine. So then they have to detach you, you get called into chemo, and every time that you have to go to the bathroom, you have to text somebody because they have to come and detach you. So it's really a long process.
You probably want to, if you're cold, want to have hot tea, coffee, but then you have to pee all the time.
All the time. It was crazy. So I was really trying to hold in my pee as much as I could, to be honest, because if not, like I felt like I was bothering them. So you finish chemo.
Yeah.
And I don't know why, but I always had chemo around 11 o'clock.
Yeah.
And so we finished chemo, and then they'd say, okay, well, the chemo ward is closed, and they'd roll you out into like plain sight, plain view, and it's like you and the cleaning crew. Yeah. That's all that's left. And because you have to stay another 2 hours after chemo. It becomes such a long day.
So it stays cold because it's plugged into that thing?
Yeah.
And so it's cold that entire time?
That entire time.
Shoot.
At some point, you just become numb to it.
Right.
I have many friends that kind of went through it and then just said they're done.
Right.
Because they were their headaches were too bad. But I had decided that I was going to go through the whole process, and whether I had headaches or jaw pains, whatever it might be, it actually didn't matter. I was going to push through it.
Yeah.
Because it was so important for me to
Yes,
not
of
lose
course,
my hair.
of course. And then how about, this will depend on where someone lives in the world, right?
Yeah.
But how much was it?
So it was...
Because out of pocket.
Yeah, it was completely out of pocket.
Yeah.
Which is kind of shameful
Yeah.
when I think about it,
Yeah.
because it really should be something that is actually offered to people, in my opinion.
Yeah.
The total was $1,200.
Okay. And
total.
is that, you did 6 sessions?
I did 6
And
sessions.
so is it an upfront, this is $1,200 because you're doing 6, or?
No, you pay per session. So some people stop in the middle. So there's an opportunity that if you don't want to continue, at least you're not stuck paying for the whole thing. Basis.
Okay. So what happened to your hair?
So I was really hopeful.
Yeah.
And then that fateful day, little pieces started to fall out while I was working. And I'm like, uh-oh, I don't think it's working. And then...
So that was how far in?
Okay, so that was after chemo number 1.
Shoot. Okay.
Okay?
Yeah.
And then I went to chemo number 2.
Yeah.
They put so much stuff in my hair, and my hair was naturally curly. And it seemed that it got very naughty. And so I come home, and I'm actually sitting in this room here.
Yeah.
Okay, my girlfriend is here with me.
Yeah.
And we're rinsing my hair out in the sink.
Yeah.
And then we start brushing it. And brushing it. And I can't
to get the knots out?
Yeah.
Okay.
I can't get the brush through. Right? Now, I had curly hair, so I'm kind of used to that.
Yeah.
And I'm brushing and I'm brushing, and then massive pieces are falling out. And in my mind, I'm like, oh, it's just fine. I have so much hair. Right? And I can't see her reaction because she's behind me. So I have no idea what's going on, right?
Yeah.
So we finally get all the knots out.
Yeah.
And I'm thinking, all my hair is still there. I'm just
Right.
missing maybe a little
Right,
bit here
right,
and there.
right.
And as I'm walking her out the door, I glance at myself in the mirror and I collapsed. I don't think I've ever screamed so loud, and I went into the fetal position and I rolled into her lap and I was screaming as if somebody had just died, because I noticed that I had actual bald spots everywhere and I couldn't believe it. And I think it was at that moment that I said, oh my God, I have cancer. And I couldn't stop. Like I couldn't stop screaming.
It's so visceral, that reaction.
Even as I talk about it,
Yeah.
it's so shocking, the pain that you get.
I know, as you're saying it, I can imagine.
And then, what's the girl to do? She calls her hairdresser. And we call her, and she comes to my house at 10:30 at night. And she gives me my first, I'm going to call it my first bob.
Yeah,
And it was a bob. Yeah, exactly like you. And she folds over some pieces so you can't see.
to cover
the baldness.
So I had assumed when we talked about this before that your hair falls out and then you stop cold capping. But
No, I continue.
you continued because there is information that if you do cold capping, it can also help with hair regrowth. So was that the sole purpose? Once you knew you're going to lose everything, or did you know that after number 2, or were you still hopeful?
I was still hopeful.
Okay. So how about after number 3?
Oh no, I was still hopeful.
But more.
More came out.
Yeah.
I mean, I actually went bald.
But at what point?
So I think after probably number 4,
Okay.
I just said, I called them.
Yeah.
And I said, like, terrible marketing.
Yeah.
Like, you told me that my hair was going to stay. And
Yeah.
the guy was super great. He's like, well, we gave you a stat. I
Yeah.
go, I get it. He goes, but it does help with regrowth.
Okay.
Studies show. Now, was that a marketing ploy? Who
Sure.
knows?
Yeah.
But I figured at this point, you know, I had gone so far.
Yeah. So you'd kind of done 4, so you're adding 2 more by doing it. Okay.
I was already committed to it. And if it was going to even help with regrowth, then that's good enough for me.
Worth it. So was there a point, it was kind of coming out in clumps, each of the cycles. Was there a point where you did a buzz or it was just
No,
like at the stage that it was a bob, things just kept coming out more and then you never
I never
cut
shaved
more?
it. No, I never shaved it.
Okay.
Because
A lot of people do.
Oh, most people do.
Yeah.
I didn't want to because I was worried that if I buzzed it, it may not come back. Yeah.
And then it feels almost so formal and permanent and right?
Yeah.
Even though that's where you were headed.
Oh, I got there.
Yeah.
I got there without buzzing it, but I did it my way. And everybody chooses to do it their way. And that was kind of my way because I was still in like denial.
Sure.
And I was putting on all kinds of stuff every night on my head, by the way.
Okay.
So I would put on castor oil and mineral oil. Like I was so greased up
Right.
that I'd have to wear a hat
Yeah.
when I would sleep
Yeah.
at nighttime
Yeah.
because I was so greased up because I'm like anything that can help to
sure.
grow the hair back.
Right.
Like whatever it was.
You mentioned the hat
Yeah.
that you slept in. I was going to ask you about head covering. So some people do chemo caps, beanies, caps. Like what did you end up doing?
So what I did is I kind of did 2 things. Well, I wore baseball caps and hats all the time.
That's how I saw you.
Yeah, I would work out in those.
Yeah.
And I was very fearful, like I didn't want them ever to come off. I was very, very shy about taking them off because I didn't want anybody to see
Right.
what I actually looked like.
Right.
So that was kind of on the daily activities.
Okay.
So knowing that there was a chance that my hair was going to actually fall out.
Right.
Prior to even starting chemo, I got my first wig.
Because you ended up getting 2. You didn't get them both at the same time?
No. No.
Okay.
So I got my first one, and my first one was so identical
Yeah.
to my hair
Yeah.
that it currently was that when I sent a picture to my husband,
Yeah.
he's like, "Why are you sending me a picture of you in like
Right.
with your hair
Right.
in the wig store?"
Right.
So he was very confused.
Wow. Because in that one, they cut it to whatever, so it starts longer. They cut
Yeah.
it to whatever length that you're choosing, which was like your previous hair. And then they colored, highlighted it,
Yeah.
like everything to
Yeah.
make it the most
Like
similar.
we went back and forth a little bit. So they probably went back 3 or 4 times
Oh, wow.
actually
Okay.
to highlight it to make it identical. And then they curled it because that's how I used to wear my hair. And so when I put on that wig, you had no idea.
I mean, I mostly saw you in caps. So did you wear the wig? Like if you went out to some event, dinner, whatever it was, you were wearing that
Yes.
wig.
So if I went out for dinners or any events or any parties, I would wear the wig.
Right.
Throughout the week, just on the regular day-to-day stuff, I just have my cap on or my hat.
Yeah. And so you never did any of the chemo caps, those sorts of things?
No, for me, I
Yeah.
didn't want to look like I had cancer.
Right.
Right. It was hard enough even wearing a cap and then seeing people would take pictures and then I can see like on the side of my head that I had no hair.
Yeah.
And it was terrible for me.
Yeah. So were there any times that you were out of the house and you didn't wear anything?
No,
No.
no. I always had a hat on.
Yeah.
Always.
And then how about at home?
There were times where I didn't.
Okay.
Right. Like, and I was fine with my daughter and my husband seeing me, obviously. I was fine with that.
So now that you're sort of looking back in retrospect, would you have done cold capping again?
The answer is probably yes.
Yeah.
But I don't know if I would have continued had my hair fallen out.
Yeah.
Because it was really a big time constraint. But, you know, there are some people, I see it all the time, right? That it actually
I know it works. I know.
They just, their hair thins out. And so I would have done anything for that. And
Right.
maybe it helped for regrowth, maybe it didn't. I'll never know.
Right.
Yeah.
How about in terms of hair loss, eyebrows, eyelashes?
Everything.
And when in the...
So I lost very quickly. So obviously the hair on my head and then my arms and my legs all gone. And I was keeping my eyebrows for a long time.
Yeah.
And then after chemo number 4,
Yeah.
I look in the mirror one day and half my eyebrows are gone. And my eyelashes gone. And I freaked.
Yeah.
It's one thing
Yeah.
to lose your hair.
Yes.
But when your eyebrows, you don't realize the importance they play on your face. And
Yeah.
same thing with eyelashes.
Yeah.
And I called my girlfriend
Yeah.
and I'm like, I don't know who you go to for microblading,
Yeah.
but I need to get the number. And she
Right.
gives me the number and I call them and I'm like, look, this is an emergency.
Right.
I woke up and I lost half my eyebrows.
Yeah.
And they were so amazing and
Yeah, I remember
wonderful.
because I think you said, sometimes you pull the cancer card. It's like, I have cancer and this is an emergency.
And that's what I did. I'm like, this is like a 911. You don't understand. And she's like, okay, I'll move around appointments. Just
Right.
if you don't mind waiting a little bit. I'm like, I don't mind waiting. I don't even know what microblading is.
Right,
to be
right,
very honest.
right.
I just know I want to look like I did before.
Sure.
After I lost all my eyelashes, it was perpetual tearing of my eyes. So that was, and then I started getting eye infections again. I was getting infections of things like I had never
Yeah,
had
because
before.
the lashes help
Protect
too.
you.
Yeah. Yeah.
So I never realized that. So I had a Kleenex all the time trying to wipe my eyes. And I'm
Yeah.
like, please just get me back my eyebrows.
Yeah.
And so they do it and they did such a wonderful job.
How long after did the eyebrows start coming in and the lashes?
I'll tell you my hair first.
Okay.
Okay, so my hair started to grow back relatively quickly. Like within 30 days, my hair started to grow back
30 days
after my last chemo.
Got it.
So I finished my last chemo in March and I had my surgery in April and I actually have quite a bit of hair.
Right.
So
Yeah.
maybe the cold cap worked.
Right.
Because within 30 days,
30 days, it was a
my,
decent
my,
amount.
my head was pretty full, actually.
Yeah. And the hair that grew in was very different.
Oh, so different. So I had very naturally curly hair and I don't know what happened.
Yeah.
But my hair now suddenly became straight
Yeah.
and all gray.
Yeah.
Which the gray I was expecting anyways. I would say that my eyelashes took a lot longer to come back, probably like 4 months.
Oh, wow.
Yeah, very long.
And then did you do any?
So I did eyelash extensions
yeah.
afterwards because they didn't grow back to the degree, like
Okay.
to the fullness that I had wanted.
Yeah. You didn't do any lash extensions when you lost them? No.
No,
And
you
then,
can't.
And then when they started to grow back a little bit, can you do them then or
I
no?
waited because you want to have, so if you do them too early,
Okay.
what happens is the heaviness of the extensions
Yeah.
actually makes your lashes fall out. So I wanted to wait a bit longer. I kind of just grinned and bared it, to be honest. I
Right.
even tried, I bought like fake eyelashes,
Right.
but I don't have the dexterity to put them on and they wouldn't stay anyways
Right,
because
right.
my eyes were constantly tearing
Right.
that they would just fall right off.
Right.
My eyebrows, they've grown back some of it, but I have microblading now.
I know
so-
they did a really good job. on
Yeah,
the
they did such a
microblading.
good job. So all I do is kind of tweeze around it.
Okay.
And then unfortunately, the hair on my arms and legs came back.
Yeah.
And that seemed to be pretty quickly. I
Right.
was like that part of my body I didn't
Yeah.
care about.
Yeah.
But it was more just
Right. And
My
then
face.
when your hair was growing, did you kind of style or cut it along the way when it was growing?
no. To this day, I have not cut my hair. The only thing I've done is color the gray.
Yeah.
That's it.
Yeah. And at what point after chemo did you color?
The gray, we waited a
forget
while
that.
actually.
Yeah.
We waited about 3 months.
Okay.
I wanted to have a fuller head of hair.
Okay.
Because there was really just no point because I was just hiding it underneath the cap.
Right, right.
So there was no point.
Okay. So this hair has not been cut
Nope.
since.
This hair has not been cut. The reason that I have pebbles
Yes.
going on is that it has grown back a bit uneven.
Yeah, because it fell out at different
It
rates.
fell out at different rates.
So
Yeah.
whatever fell out first, that started growing back first,
Yeah.
and then okay.
Yes.
Yeah.
So that's exactly
Yeah,
what's
because
happening.
this is very different length than this.
than the back part, which
Right.
is so crazy because
Right.
people actually look at me and go, "Oh, it looks like you've actually styled your hair,"
Right,
and I haven't.
right.
Once it all gets to some level, then I'll I'll cut it.
Right.
But at this point,
Right.
I'm just letting it go.
Yeah. And do you still wear the wigs?
I do.
We never talked about the other wig too.
Yeah. So
The fun wig.
yeah. So midstream, I
Yeah.
decided to get a fun wig.
Okay.
Probably more to mirror the length of my hair that I have
Yeah,
now.
yeah.
Actually, so a short
But
blonde
blonde,
wig.
yeah.
And I got that one, and I absolutely love it. I don't even wear the other wig.
I was going to ask you, so do you still wear either of them?
I do. When I have events, I actually put on the short one.
Okay.
Because I don't have a hairstyle, and I feel like it would be kind of weird to go out like at a big event or a wedding with like my Pebbles hair, I call it.
Yeah.
So I put it on, and it actually still makes me feel more like me. More the blonde. People say, oh my God, they love my hair, this color, and how it looks on me. I still don't feel like me.
Yeah. Can you walk us through more about what your actual chemo appointments looked like? So we talked about the cold capping, but
Yep.
what happened when you were actually in the chair?
I had to do 6 chemos, and they were every 3 weeks apart.
3 weeks, okay.
Yeah, so I like to call it like the hamster wheel. Just as you're starting to feel better, you have to go to chemo.
Go again.
Yes. So the day before chemo, I'd actually walk in for a blood test. It would give you the yay or nay for chemo.
Sure.
I had to take meds a few days before. Like I
Okay.
had to take a prednisone and a Claritin and an Anaprox. So you have to kind of work your way.
Okay.
I would always have to go there a bit earlier because of the cold capping. And then I would have to sit there and wait for them to call me in. And I was always a bit on the edge because they don't call you in by your name. They call you in by your number, your
Right.
hospital number.
Right.
Well, I couldn't remember my hospital number. So I would actually write it on my hand.
Right.
And then I had this whole cap on my head.
Yeah.
And I couldn't hear because of the machine. And
Right.
it's quite the production actually when you go there, because you go there, you check yourself in. I had to go cold cap. Then you have to run to the pharmacy and get some meds that you have to take right before chemo. So I'd have to always have somebody with me.
Right.
Because they'd have to go to the pharmacy.
Yeah,
and-
because you're plugged in. You can't get up. And
yeah, I
go.
couldn't
Yeah.
roll the machine,
Yeah.
and I didn't want to ask the cold cap lady to help
Right.
me. So somebody would be, I'd call it my runner, and so they'd run back, get the pills. I would take the pills, and then finally my number would get called, and I'd be in this great recliner. And they would give me all these warm blankets.
That's good, because sometimes people have to bring blankets, but they...
and we'll talk a bit later about what I brought, because
Yeah.
I used to come with blankets
Yeah.
too, because you don't know. So I would then sit in the chair, and then the nurse would come. They ask you your name about 100 times, which is kind of annoying.
Yeah. But helpful, because if they're going to give you chemo, they want to make sure you're giving it to the right
It's
person.
true. And then they would ask me my birth date, and
Yeah.
I would just lie for fun, because why not? So I really tried to make light of the situation.
Yeah.
And then they would obviously, I had a port.
Oh, yeah, I was going to ask that.
Yeah, so I had a port. I didn't have a choice on a port, to be very honest.
Okay.
So initially, it's kind of like everything else.
Yeah.
With me, I'm like, oh, well, we could just do it through my veins.
Right.
And they looked at me and they're like, yeah, no.
Okay. And then in terms of what you wore so that the port would be accessible,
So I would wear like a t-shirt or a tank top that had low cut, and then I would have a hoodie with a zipper.
Okay.
So everything that was really easy. Once they accessed my port, they'd bring all the medications, we'd review it, and then the process would actually start.
And then how long would you be in the chair getting chemo?
So the first one is always the longest, because they're actually putting them in separately.
Okay.
Because they want to see if you have any reaction.
Okay.
But after that, I would be in the chair for about 3.5 to 4 hours. But again, it really ended up being 8 hours.
Yeah,
because of the cold cap.
Before, after.
Yeah.
Yeah, that's a
and
long
that was the
time.
brutal part.
In terms of neuropathy, to try to prevent that or at least reduce, you did the ice on your feet and for your fingers. Yeah. And so did they suggest that for everyone? Like they recommended that for
Depends
you?
on the type of chemo.
Okay.
So based on one of the types of chemo, they said that actually it's kind of twofold. It's neuropathy and also your nails.
Oh, yes.
It's to protect your
yes.
nails, right? So I'm like, okay, well, I have to protect my nails.
Yeah.
Like that was another really important part of my body. And so it was just for 1 hour that I would have to do it.
So one hour out of the 2 to 3, whatever
Yes.
it was that you were sitting in the chair.
Yes,
Okay.
so once that
1
keep-
hour is a long time to be.
Oh, yeah.
Yeah.
I mean, it was not great. The feet one was better because they take the ice packs and they tape it around your feet.
It looked like in the picture you had cozy socks on.
Yes.
With the socks, was it cold enough from the ice for it to be therapeutic? Like you felt it
Oh,
still?
I felt it.
Okay.
I felt like I had no feeling.
Okay.
And then I had to put my hands in ice, in actual ice. And my fingers were like practically frostbitten.
It was actually just right in the ice
right in the
versus
ice.
your toes.
Yeah,
down.
which my toes were actually wrapped around, so it
Right,
didn't feel as
right.
bad, and I had socks on top of them.
Right.
I think they're less concerned about toes, they're more concerned about nails. I actually have some friends that actually lost all their nails, or their nails got very, very weak, and they were just kind of falling off.
Yeah, like quite brittle, right?
Exactly.
Yeah.
So I stuck my hands in there like nobody's business and tried to keep them there, and I tried to just breathe right through it. It was really I'm going to call it a mindful exercise.
Yeah.
To like keep your hands in there, close your eyes, breathe, and do exercises so you don't have to pee.
Right.
So that was really the whole process, because every time that I wanted to get up in the middle to pee during this ice exercise, my friends that were there with me were like, mm-mm.
Yeah, I wanted to talk about that after.
They were like, absolutely not. You're staying right in there.
Right,
because
right.
they knew my game. Because as you're walking into the bathroom, that chemo is still going through your veins, right?
Yeah.
So that's just, all I'm doing is just kind of wasting time.
Yeah.
So nobody would let me go to the bathroom during that time. Like, but I have to. They're like, no. I'm like, okay.
Yeah, so tell me, so how did it work? Because I know you really set things up with your friends to make it a whole thing.
Yes, I wanted to turn chemo into fun. I mean, it's not fun, but let it be as fun as it can be.
Sure.
My husband took me to my first chemo.
Yeah.
And I love him to death, and I really do, but he was useless. He sat there and he slept, and then he gets up, and this is a true story. He gets up and he's like a little dizzy, and all the nurses flock to him. I'm like, no.
Yeah.
You're out.
Yeah.
Right.
Insert friends.
Yeah.
Yeah.
So I did a sign-up
Okay.
list, and I said, I want my friends to be part of this experience with me, if they want to be, of
Sure.
course. Well, they all signed up.
Yeah.
Okay, and competition on.
Yeah.
And it was not even about me.
Yeah.
They were competing against each other.
Right.
Around who's going to bring the best food. Right? And who's going to make it the most fun.
Yeah.
So that is what they did. And we had so much fun. We would sing show tunes. We would chat. When do you get 8 hours with a close friend?
Girlfriends too.
And I'm at my most vulnerable point. So now they're seeing me bald. Now they're seeing me want to rest. And I'm just like, who cares? And we would sit there and laugh and gab the whole time. It was crazy. So we made it a great time, and the nurses obviously loved us.
Yeah, yeah.
Right? Because it's not a place where there's a lot of laughter, and there's not a place where there's a lot of anything. And we would share food with everybody and talk to everybody and just try to make it, a positive experience.
Now let's talk a bit more about the practical side. So things you brought with you.
Yes. So I had to bring a lot of extra things because of the capping.
Oh, of course. Of
Yeah,
course.
so I had to bring a hairbrush. I had to bring towels.
So you do it.
Well, I
brush your
never
hair.
used any of it.
Okay.
But they told me to bring it. Shampoo of some sort. And then in my chemo bag, so let's say the capping aside, in my chemo bag, well, of course, I had full of chargers.
Yes, because you're there like the whole time.
Yeah, so I had chargers, I had an iPad, I brought a book, I brought magazines, I brought socks, I brought a change of clothing, I brought an extra sweatshirt, and I brought a blanket. So, and then obviously snacks, water and food and all of that stuff. So,
I guess any magazine, tablet, any sort of thing like that, like when you're on ice, like you're
can't
really
do
not doing
anything.
anything other. You could listen to a podcast, but you're not
so
like.
that was the other thing I brought was my AirPods, right? So that I could listen to a podcast or I could listen to music. And I also brought my cancer binder.
Yeah.
I had a big binder,
Yeah.
so I would bring that. Oh, and I brought like Lipsol, right? Because your lips get dry.
Yeah.
Hand cream.
Oh, you told me before for your feet, you brought slides.
Yes. Oh, yes. That was so important. So I came in, let me talk about the clothes I wore. So it was all about comfy clothes. And over time, they just got even comfier.
Yeah.
Right. So I always wore like.
So you weren't in your suit with your
No
bag?
suit, no jeans.
Yeah.
No, nothing. Like I was wearing athleisure wear.
Yeah.
And then I actually moved even into sweatpants.
Yeah.
Which is so not like me.
Yeah.
But it was like the comfier, the better.
Yeah, that makes
right?
sense.
So like big t-shirt, make sure that you're wearing a hoodie so that you have a zipper. You don't want to put anything over your head. That is like really key. And then the most comfiest, and then really warm socks because you get cold.
Right.
Right, and your temperature fluctuates while you're in there.
Yeah.
Freezing.
So with the extra clothes that you brought, you know, because you were so cold, did it really help to sort of change into something fresh and warm?
I never did.
You never did?
No.
Okay.
No, I never did. So the
Okay.
slides were the most important thing because so I wore running shoes, and then I was going through winter. So just keep that in mind. That's why I brought slides. If not, I just would have worn them.
Yeah.
But it was easy to get up and go to the bathroom and put my feet into slides. So I will tell you that my chemo bag over time dissipated. So what I brought from my first chemo to what I brought to my last chemo was significantly different. Essentially what came to my last chemo was my AirPods and my plugs.
Yeah.
That was it.
Right.
And my Lipsol, which I always have, and maybe some hand cream.
Right.
But beyond that, nothing else came.
Right.
I didn't need the blanket because they provide blankets. I didn't need the change of clothes. I never used them. So it was so interesting of what you come with to what you kind of leave with.
Right.
What you end up with, I should say, at the end is significantly different.
Right. And I would imagine that because you were going with friends, you know, what you would need would maybe be different than if someone was going solo. And, you know, because you're really bringing things for comfort. Right? All the warm things, or you're bringing things to pass time.
Exactly.
And so you weren't probably needing to pass time the same way if your friends were there.
Yeah, I think that's a great point. With my friends being there, I never even put in my AirPods.
Right.
I very rarely used my phone because we were just sitting there and just chatting. Right. So it was great. Like I didn't need all that stuff, but yes, if I had been alone, then obviously it would have been useful to have the book or the iPad or whatever it might be at that time just to pass time. Exactly. Or sleep.
Chemo side effects can be tough, so let's talk about what you experienced. And I think it'd also be helpful to say what you did to manage some of the side effects and if you still have some of them, because some of them go away and some of them don't.
Correct.
Yeah.
So I pretty much had almost every side effect in the book.
Of course.
Which was crazy.
Yeah.
So what I did is I created an Excel spreadsheet.
Yeah.
What I wrote was all the side effects I was having day by day by day, just to see if they would kind of progress or they would actually regress, because we didn't know.
Right.
So the key side effects that I had was constipation. It was horrible.
Yeah. And that's
Horrible.
from the meds.
That's all the medication that I was taking.
Yeah.
And so they give you medication also to take to go to the bathroom. It just wasn't working. I've always had some GI issues.
Yeah.
So the truth is, I knew I was going to be in trouble.
Right.
So constipation was one.
And some people have
the opposite.
the opposite. Yeah.
Yeah, exactly. The second one was mouth sores. Absolutely horrible. Horrible.
Like all over?
All
or
over my tongue.
Oh, on your tongue, so not in the...
Not in the mouth, on the tongue. So they make something called a magic mouthwash, they call it. And so what that does is it numbs your tongue. So it doesn't take away the actual cold sores, it numbs your tongue so that you can actually eat. So I had to, from chemo to chemo to chemo, I had to learn how to eat differently. So things that were more bland so that they wouldn't start to, because if I had anything spicy...
It aggravates?
Correct. And to this day, I still get them.
Do you really?
Yeah. So I have to be very careful. Even what I eat today, if I eat something that's too spicy, I get one of those mouth sores.
So when do you put the mouthwash?
So before you eat.
Before you eat anything?
Yeah. So not anything, but anything that's like a little bit of a spicy variant.
Okay.
You put it on, or you put it on, you actually take it to be able to eat.
Okay.
Because it's so painful.
Right. And you mentioned something to me before, like a special toothpaste you were using?
Yes, it was a special toothpaste, so it really had no flavoring in it because obviously anything would just inflame anything on your tongue. I ended up just going back to like having shakes and yogurt, anything again not to aggravate my tongue, because it would be terrible.
Right.
So I did have some nausea, but the medication today is so good
that
the minute I felt it, I took the med knowing that that med was going to give me constipation, by the way.
Right.
But I took it, and it was great. So it really managed the nausea. I had neuropathy, so which was what neuropathy is, having no feeling, like pins and needles in my hands and feet.
We talked about doing the ice, so
Yeah.
let's talk about the timeline with when you had the neuropathy and then what's happened since.
So I had the neuropathy almost right away.
Okay.
So the ice didn't prevent the neuropathy. I'm going to say that the ice actually prevented my nails from splitting. But I still had neuropathy, especially in my thumb. Today, I still have some of it.
I wonder, again, because it's not like we have a control where one hand was in ice and one hand wasn't. Like, I wonder, because some people will have it in all their fingers,
Yeah.
right?
Yeah.
And toes. And so I wonder, did the ice help to reduce the amount
I think
of
it did.
neuropathy, right? That
I think it
that you
did.
got.
I think it did. I had a ton of bone pains.
So it's interesting because you're also on an AI,
Yes.
right? And so what was the timeline of when you started that? Because there's so many symptoms that can come from both.
Yeah. So I started the AI when I finished chemo.
Okay.
So
So
I
you know
started-
anything you were experiencing during was only chemo.
Exactly.
Got it.
After every chemo, I had to do a shot.
Yeah.
That was to increase my white blood cells.
Yeah.
And that shot felt like I had arthritis. So I would literally be in bed whimpering from the pains in my legs specifically. So another symptom I had obviously was fatigue.
Yes, that was a big one.
Big one. So, and I wasn't really falling asleep. It was just, I had to rest. I still have that today.
Yeah, and they call cancer-related fatigue,
Yeah.
and so it's basically fatigue where you can't nap it off, right? So it's
No.
more sleep
No.
does not help
Nope.
this type of fatigue, right? But what did you do that helped the most, would you say?
With the fatigue?
Yeah.
Exercise.
Yeah.
I have to
That's
tell
actually
you,
the most researched thing that helps. Even though people probably don't feel like doing it.
No.
Yeah.
No. And so I changed my exercise time.
Okay.
So that helped me. So I've always been an avid exerciser, but I used to do it at 6 a.m.
Yes.
I changed that.
Yeah.
Because I couldn't.
Yeah.
Because I wasn't sleeping. So
Right.
sleeping also is another side effect.
Right.
I had terrible insomnia because I was on all these drugs. Because I couldn't sleep, I would go around 10 in the morning.
Right. Okay.
So I felt that it was more doable.
Right. That makes sense.
So that would help with the fatigue, at least kind of push me through. And it also helped me with my other symptom, which was brain fog.
Yeah.
My brain fog was horrible. So it felt like I was disconnected from my body and I was having an out-of-body experience. And I would be like, wherever I was, whether it be the gym or in the house, it felt like things were happening around me,
Yeah.
but I had no control.
Almost like you're not fully a part of it.
Exactly.
Yeah.
And as I was exercising, I would find that my brain fog would start to dissipate. So I found that the exercise piece kind of helped on the fatigue
Yeah.
and the brain fog.
Yeah, I remember you said even in the mornings, like it'd be so hard to get out of bed for fatigue, but also joint pain, you know, all
Yeah.
multiple things.
Yeah.
But you would go and exercise, and then it would be like you're a changed person
I was.
on that particular day just by doing it.
And even my personality changed. So I got happier, right? So the endorphins were releasing in my body.
Right.
Another side effect I had, which I thought was pretty bad, was my taste changed.
Yes.
So I considered myself a foodie. I couldn't eat anything. Coffee, I didn't enjoy it.
Yeah.
Everything tasted like metal.
Yeah, which is also probably why, because I wanted to talk about some people lose weight and some people gain weight,
Yes.
but your lack of taste was probably a pretty big contributor to you, right? You had weight loss.
Yeah, so I lost 30 pounds.
Yeah.
And it was just, I was starting to wear a size 14 for kids. And
Yeah, like 30 pounds on your frame.
it was,
Yeah.
I had never been
was a
so
lot.
skinny, and
Yeah.
I wasn't trying to.
Right.
Right. And again, when you start to get skinny like that, and you have no hair, what do people see?
Cancer.
Cancer.
Sick.
Sick. I couldn't eat. That was the other thing. I lost my complete appetite between the mouth sores and the taste in my mouth, the
Right.
lack of taste.
Right.
I couldn't put food in my body.
Right. And then how long did that part of it last? Like the lack of taste? And...
Oh, 6 months post chemo. That one took a lot. Sometimes if you take some medications like erythromycins or the like, they actually also give you a metal taste in your mouth.
Okay.
But once you're finished the medication, 2 days later, it's gone.
Sure, sure.
Right? So this was not going, and I was very scared. So remember how I put all the symptoms on a piece of paper?
Yeah.
So I had a day-by-day symptom, and I would actually hand it to the oncologist. Here's all my symptoms day by day between one chemo to the next.
Yeah.
And then here's all the exercise I did. It's like I wanted a good report card, right?
We're so similar.
Right?
Yeah.
And so, okay, so here's all my side effects, but at the end of the day, it didn't impact me because look, I played tennis today, I did kickboxing today, I walked 15 kilometers.
Yeah.
Right? And
you're doing weight training.
and I was doing weight training at least twice or 3 times a week. And so I handed it to her like it was like my report card.
Right.
And I wanted her to come back and go, okay, you got a star and it's A+.
Right. Good job, Farla.
Yeah, exactly. That's what I was looking for, which is like, again, insane.
Yeah.
And I also did that because if there was issues that I needed her to solve, we didn't need to go through all my side effects. She can clearly read them herself. Yeah. So it was easier for me to say, here's all the symptoms.
Right.
Now let's solve for them.
Right.
And that's what we did. So
Right.
we had it was just a great way to communicate with her.
Yeah, no, that makes sense. And so of the ones that you had, you still have...
I like to call it a triple ven that I have today. And it's the chronic fatigue, chronic pain, and chronic brain fog. And clearly, if I don't sleep, that impacts your brain fog, right?
Sure.
Obviously, if I don't sleep, that impacts the pain. So they all kind of tie into each other. I can't tell you which one is the cause or effect.
Sure.
And also, the truth is yes, these are all post-chemo, but I was forced into menopause and I have no estrogen in my body. So who knows where that sits around.
Right.
Obviously, when you are forced to, no longer have estrogen, that increases your brain fog too. Right. And your pain and your tiredness.
Right.
So it's really like, it's a triple ven and a triple whammy.
Yeah,
frankly.
you have another sort of source of, what could be causing some of these side effects, and it's really hard to parse out what's from what.
Yeah.
Chemo isn't just physical, it's mental too. So how did you manage to take care of your mental, emotional health?
I had an incredible village. So I had such amazing friends that honestly, if anybody was so lucky, it was me. And having that support from my friends and my family was kind of incredible.
Yeah, that was such a big piece of it, I think, what your friends did.
Yeah.
Because chemo was such a big piece of your overall treatment.
The other thing is that I did was I wrote a blog. So people were always reaching out to me and I was getting tired. And so I started writing. And that was very cathartic for me. And I would write about how I was feeling, whether it was good or bad or anything. And it was quite raw. And I would send it out to a whole group of people.
So you emailed it out?
I actually texted it out.
Okay.
And so it allowed people to understand where I was, where I was in my journey, how I was progressing. So of course I would say, I'm 1 out of 6 or I'm 67% full, because I didn't feel like going retelling the story every time.
Right. To so many different people.
Yeah, I just needed my own space and time, and I was very open about cancer too.
Yeah, we were similar.
Yeah,
like that.
so some people are, and some people are not.
Yeah.
I had a friend going through it, and nobody knew. Right, so I was very open, and I kind of exposed myself early on about it because I really wanted to. I wanted to talk about it, and I wanted to advocate about it because mine was a mammogram was clear. So the fact that it was the MRI that found it, I'm so grateful to that, to the radiologist that had a good day. There was one moment in one of my oncology appointments where I actually kind of lost it. My mom was diagnosed with brain cancer. and that had metastasized. It went from breast to lung to brain. And at the time of the oncology appointment, she was actually having brain surgery.
Yes, I remember that.
And I was sitting in that appointment talking about a double mastectomy.
Because it was originally going to be lumpectomy.
Lumpectomy.
Yeah.
Well, that's what they were kind of pushing me
Yeah.
towards, and I didn't want that. I always wanted a double mastectomy.
Yeah.
And I just lost it. So that was the only time I actually lost it. And I said, I'm a ticking time bomb. And
Yeah.
you realize my mom is actually going through brain cancer surgery as we speak.
Right.
And they turned to me and they said, are you getting help? And do you have someone to talk to? And I said, well, I talked to my husband.
Yeah.
And I talked to my friends.
Yeah.
And they said,
No.
do you have someone to talk to?
Yeah.
And I said, no, I don't, I'm good.
Yeah.
And they're like,
No.
you're not. And I'm like, what do you mean? And they're like, no, you're not.
Yeah.
And that was probably very hard for me because, again, I felt like I could battle anything.
Sure.
Right?
Yeah. Yeah.
And it was like, oh my God, you're right. I actually do need help.
Yeah.
And quickly I went to see a psychiatrist and a psychologist. So
Yeah.
I really
You got everything covered.
I was all in now.
Yeah.
And realized I needed help.
Yeah.
Because I was losing who I was, and I was still in somewhat of a denial. And I also finally decided that it was probably time that I go on medication. It started with a teeny tiny dose, and then it went up a bit more. But I felt that it kind of leveled me out a bit more because I was crying a lot, and I didn't realize to the extent. And
You're also, sorry to interrupt, you're also still in it.
Yes.
Right? And so I think from others' perception who don't have cancer is that sort of once you're done, you did your chemo, you did surgeries, you didn't have radiation, but you've done all what they call active treatment.
Yes.
Right? And so you still have all these side effects from that.
Yeah.
Right? And then you're on letrozole, you have side effects from that.
Yeah.
So it's not like it's, okay, that was cancer and, okay, yeah, I'm done that thing.
Yeah.
And now I'm just like back to normal. It's like you are really still in it, you know? So it makes sense why there's struggles at this point, and makes sense that there's struggles even further out.
Yes.
Because you're still in it.
People look at you and they go, oh my God, you look great. And you look fine. You're done chemo.
Yes,
Let's
the
have
congratulations.
Let's congratulate. No.
Yeah.
What are you congratulating me for?
Yeah.
It was so, I call it anticlimactic.
Yeah. Yeah.
Okay.
Yeah.
And the truth is, when I finished chemo, right, I should have been celebrating. Instead, I was standing up eulogizing at my mother's funeral.
Yes.
So, and then when I finished Herceptin, I was standing up and eulogizing at my father's funeral. So there was a lot of stuff that was going on, right, outside of even this cancer piece of it, where, yes, I needed help, and I finally accepted that help. You're constantly searching for yourself, and the truth is, you're not yourself. This is a new normal, and it's easy to say the words new normal. It's very hard to accept the new normal.
Yes.
Right? You and I talk about that all the time.
Yes. Yes.
Right?
Yeah.
And the new normal, I sit there with my psychiatrist all the time and say, no.
Yeah. I will say that even in the last year, so I'm 4+ years out, I have had more self-acceptance of this new normal situation. So I am further along in that process, but you know, I'm pretty far out and still
not accepting it.
Yeah.
Exactly. So the question is obviously the question I ask myself and everyone, when am I going to give it up? Right?
Right.
When am I going to let go? And you're further out, so you're starting to let go. I'm still not there yet.
Yeah. If someone was about to start chemo, what advice would you pass on?
I would say to stay active.
That was a really big piece for you.
For me, that I actually would say that was my saving grace. So whatever I did before chemo, I continued throughout chemo. And if you're not an active person, even if you just walk 20 minutes a day, it really helps with the clarity and the bone pain and gets kind of things moving.
And the fatigue.
And the fatigue, of course. Decide who your network of people are and lean on them and be vulnerable, because I thought that was really good for me. The other thing that I did was I joined a lot of Facebook groups.
Okay. Which can sometimes be good and sometimes be bad.
Yes. And it was, right? Because they tend to be a bit on the negative side. But the good part about them is I learned a lot.
Yeah.
Right? I learned a lot, and that helped inform some of the questions I had for my doctor. The other thing that I did a lot of was I journaled.
Yes, I did that too.
And
so important.
It's so important. And so because you forget a lot of things.
Yeah.
And I wanted to journal this experience.
Yeah.
And then I actually started to journal it and post it on this Facebook groups.
Okay.
I also did a lot of classes. So I signed up for everything, right? Brain fog classes, fatigue classes,
Fear of recurrence.
And now I'm starting another one.
Okay.
To help with some of my anxiety that I developed, because I didn't have anxiety before,
Right,
and now
right.
I have anxiety because I wake up every day thinking it's back.
Yeah.
And so I'm doing a mindfulness class now.
Okay.
So
good.
I've signed up for everything. So
Yeah.
I think that's really important, that you need to really have an open mind and not do this alone, because there's so many people that can help you, and there's a community of people that want to help you.
Right.
So I think that's really important.
Right. Thank you so much for doing this with me. I think this is going to help so many women watching. If you had chemo, I'd love to hear about your experience in the comments. If you have any tips or advice, that would be awesome too. Thanks for watching.